Can you predict if a woman is capable of a vaginal orgasm just by looking at her? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about orgasms, particularly orgasms that come from vaginal stimulation. Now, if you're new here, you might not know this, but 85% of women need clitoral stimulation to climax. This means that only about 15% of women can climax from vaginal stimulation alone. So it's actually relatively uncommon for the majority of women, and most will need clitoral stimulation as well as vaginal stimulation sometimes for climax to occur. Now, what if I told you that maybe there is something to the way a woman carries herself that might indicate if she can have a vaginal orgasm or orgasm through vaginal penetration? Well, a Belgian study wanted to figure this out. So they recruited 20 healthy Belgian women, half of whom reported experiencing vaginal orgasms and half of who did not. Now, again, this is self-report. They filmed the women walking on the street without the women knowing why they were walking on the street or why they were being filmed. Then they had sexologists watch the video and try to guess which women were able to climax from penetration alone. And you won't believe this, but the sexologists were able to correctly identify which women had vaginal orgasms 81% of the time. They found that these women who had a history of vaginal orgasm tended to have a more fluid, sensual, or energetic and free gait. They had more pelvic and vertebral rotation and a longer stride length. In comparison, women who didn't have a vaginal orgasm had a gait that was more flaccid and locked. This might suggest that a way a woman walks is providing clues about her sexual response and function. Now, in your head, this might be totally unrelated, but your pelvic floor is engaged, you have anatomic variations and psychological factors that play a role in your gait. So, when you think about your pelvic floor, you're using it with every step you take. So if it's functioning normally, you're probably having more orgasms and your gait is probably more free. Also, if you're psychologically feeling more confident, you may find that you're able to have orgasms more often and you're also more confident when you walk. Again, this is a small study, but I thought it was so interesting that something that we do in private might actually translate to how we carry ourselves in real life. Now, next up, researchers found that looking at a female's anatomy might explain why some women have vaginal orgasms easier than others. And this area that they looked at also includes the area that we all know as the G-spot or the G-zone. It's located on the top side of the vagina or the anterior vaginal wall. It's about 2 to 3 inches inside the vagina. And this area is particularly rich in blood vessels, nerve endings, and includes the Skene's glands. The Skene's glands are essentially homologous to the male prostate. And these areas do have nerve endings that can be deemed pleasurable when they are stimulated in some way. Another point is this area, when you're stimulating it, can indirectly also stimulate the clitoral shaft. For those of you who are new here and have probably never heard the term clitoral shaft, the clitoris, the part that you see, is just the head of the clitoris, just like the head of the penis. But just like men have a shaft of their penis, women also have a clitoral shaft or an extension of the clitoris that goes deep into the pelvis, very similar to male anatomy. And so when you are stimulating that anterior vaginal wall, then you will also potentially putting pressure on the clitoral shaft, which can then elicit pleasure. So the space that I'm talking about that the researchers looked at was the entire space between the urethra, or where the urine comes out of, and the vaginal wall. And this is called the urethral vaginal area, which again includes the G-zone. So there were 2 studies that looked at this area, and they wanted to see if there was any anatomical variation in this particular area in women who had vaginal orgasms. So in the first study, researchers recruited 20 healthy women. 9 had vaginal orgasm and 11 did not. And they used high-resolution ultrasound to measure the thickness of this space. And what they found was actually pretty interesting. This space was significantly thicker in women who were able to have vaginal orgasms compared to those who could not. Specifically, the numbers were that the median thickness of the urethrovaginal space was 12.4 millimeters in women who have vaginal orgasms compared to 10.4 millimeters in women without. Now, this might sound like a really small number, but it's a really small space. So 2 millimeters is a pretty big difference. Now, they looked at different segments of the space, meaning was it distal, middle, or proximal of the vagina, and they found that they were thicker all throughout in women who experienced vaginal orgasms. And they found that the greatest thickness was actually of the distal segment, meaning closest to the opening of the vagina, where again the G zone lies. Now, the researchers thought that this difference in anatomy might be that there is more nerves, blood vessels, or larger glandular structures like the Skene's glands in this area, which are likely playing a key role in the physiology of being able to obtain a vaginally stimulated orgasm. Women who have a thicker space probably have more clitoral tissue as well, and more glands and more nerve endings embedded in the anterior vaginal wall. And this allows for more direct stimulation during intercourse. So this brings us to the next study, which looked at an even closer look using 3D ultrasound and Doppler imaging of the urethrovaginal space. And so Doppler imaging actually looks at the blood flow using ultrasound in this space. This particular study included 39 healthy young women aged 24 to 30 years of age, and 19 of them had vaginal orgasms and 20 did not. And so the 3D imaging showed that the structures within that space have, again, a gland-like appearance with very small blood vessels feeding into them. And interestingly, the total volume of these structures was significantly larger in the women who experienced vaginal orgasms, which was 0.59 milliliters on average compared to 0.26 milliliters in women without vaginal orgasms. That's more than double the size. And also the length of the space was also longer. The researchers also found that the volume of these structures was correlated with some other things. So it was also correlated with how long it had been since the woman's last sexual intercourse, as well as how much testosterone and androstenedione she had in her blood work. So what does that mean? Well, if she's had more time since the last time she had sex, she has more volume in her glands probably, which are located in that space. And so that makes sense. In terms of testosterone and androstenedione, it's possible that these structures are also hormonally sensitive. So women who have higher levels of testosterone might have more volume in these areas. They did not see a difference, however, in the average testosterone levels overall in both groups, as well as the difference in blood flow between these two groups. One, I think it's really nice to think that this is probably anatomical. So the reason some women are more sexually responsive to vaginal penetrative sex are likely because their anatomy is different. Now, there's obviously other factors with how people walk that may be psychological and pelvic floor related that could also play a role in this as well and might actually help women feel more comfortable and confident in general with sexual activity. Thank you guys so much for joining me today. If you guys love this, please make sure to subscribe and share this channel with anyone you think might find value in it because it means so much to me. If you share on social media, I would love to see it. Make sure you tag me. I'm on all the platforms as @Rena Malik MD. And as always, remember to take care of yourself because you're worth it.